When you wake up with stiff joints or back, what you think is that your body is running out of the fluids that provide normal lubrication for your joints to allow movement. You think of it like as if the joint is lacking the normal oil that provides that good flow of movement as you do your activities. But inside your body, the joint is not just stiff. It is actually experiencing a biological traffic jam. If you do not understand what happens at the microscopic level, that is at the tissue level, then doing the stretches might actually lead to more wear and tear to the joints and the tissues. We usually tend to ignore morning stiffness and assume that we are getting older. What we do not know is that these are body's alarm system. The body is warning you. The nervous system is actually giving you a warning of what is to happen to your body. When a joint is immobilized for a long period of time or given an incorrect load, then the tissue, that is the fluid, will shift. So as the fluid shifts, your tissues will thicken, and what happens is that your brain will now turn down the muscles. It will turn down the muscles. Now, forcing a stiff joint to move is actually like forcing, or like let's say driving a car without a brake and expecting to use the emergency brake. That is what happens when you try to force a stiff joint to move. Now, your body joints are lubricated by the synovial fluid. The joints are lubricated by the synovial fluid. When we rest, that is including 8-hour sleep, what happens is that this fluid thickens and it becomes more of like gelatin. So the fluid, it will shift in position and then thicken, and it becomes in the form of gelatin. When we move, that is after waking up or after being immobile, what happens is that the change in the temperature and pressure will slowly turn back the fluid into its normal slippery form to allow for that normal joint movement. Morning stiffness is not a permanent thing. It's a temporary phase that actually requires programmed loading to allow for the fluid to reset back to its normal state. Around every joint in the body is a tough fibrous joint capsule and strong ligaments that surrounds the joints. Now, if the joint is not moved up to its full range of motion for a long period of time, what happens is that the collagen fibers will start to cross-link. And as the collagen fibers cross-link within the joints or around the joints, what happens is that the joints will stiffen. It will wrap up. Now, this reduces the space, the physical space in between the joints, and it increases friction on the cartilage as you try to move. So as you try to move, there's that increase in friction. As you try to move, you cause more harm to the joint due to the decrease in the space and also due to that increased friction on the cartilage as you try to move. Now, the body joints are packed with mechanoreceptors. Mechanoreceptors are sensors within the body that tell your brain about your joint in space. So they tell your body about the proprioception. These mechanoreceptors, what they do, we have several examples. One of them include the type 1, which are the Ruffini, type 2, which is the Paciniform. Then we have the type 3, which are the Golgi tendon organs. Then the type 4, which are the free nerve endings. Now, what these mechanoreceptors do is that they recognize any problem within the joint. For example, increase in tension, pain, all those they do recognize. Now, within the joint, these mechanoreceptors help with proprioception. And proprioception is your body's position within space, So they recognize that proprioception within the joint. Now the stiffness that we actually feel during that active range of motion, that is when you do it by yourself, most of the time it is not a structural thing, and it is a nervous thing that is caused by those mechanoreceptors. Remember, the mechanoreceptors, there are some that will detect pain, like for example the free nerve endings. Then we have the things like the Golgi tendon organ, and also the type 1 and the type 2. Now these will be able to detect as they are located in the different parts of the joint. Some are located within the superficial, some are deep, and some are within the ligaments. Now these will be able to detect any change in the proprioceptive activity. Now the hyaline cartilage within the joints have no direct blood supply or nutrient supply. They rely on that, what we call the imbibition. Now what this means is that they rely on that active movement of the joints. So as you move the joints actively, what happens is that there is nutrient supply, there's that blood supply, fresh blood being supplied to the joints, and as it is supplied, it also helps to refreshen up by removing the waste products within the joint. Now, a joint that stays stiff and immobile for a long period of time is actually starving its own hyaline cartilage of the nutrient supply, and this leads to wear and tear when you force that movement. To stop your joints from locking down over a period of time, you need to remember the following. Number one, movement will decrease the thickness of the gelatinous synovial fluid. It will make it go back to its normal state, that is after prolonged rest. Number two, consistent full range of motion will reduce that cross linkage it will reduce that cross linking of the cartilage within the joints, and therefore prevent that stiffness. Number three is that your brain uses that stiffness as a protective mechanism, and it should not be forced with movement. You need to do that guided activity in order for you to relieve the stiffness. Then number four, movement is the only way to feed your joint cartilage. Movement is the only way for you to feed the joint cartilage.